to the WHN broadcast. I'm your host, Karen Ruby. Today we are joined by Dr. David Berger. And David, you've been talking about infections in healthcare. Do you want to tell us what's going on?
Yeah, sure. I mean, this really blows my mind that we are now tolerating what is effectively rampant infections of COVID and other respiratory viruses, but respiratory transmitted viruses in healthcare. So as an example, there's been persistent data in the UK showing that at least 30% of COVID infections in patients in hospital were acquired by those patients in hospital. And this is very standard data that we see around the world. We had I was actually leaked some data here in Australia from Victoria, which showed a 10% death rate in 2022 from hospital-acquired COVID infections. And subsequently, one of our newspapers here, The Age, did a Freedom of Information request. And again, we see that about 30%, at least 30% of patients in hospital with COVID infection acquired it in hospital. So we have a massive problem here of transmission of COVID, along with other respiratory viruses. It's, from in past years when there was an influenza epidemic, we would see huge numbers of people contract it in hospitals. So this is a huge ignored problem.
This sounds terrible.